Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Joan Buckley from the nursing department here at Nassau Community College. And today you're going to learn about the HPV virus and its relationship to cancer and the vaccine that's available to fight it. My guest today is Dr. Abraham Aragones. He's internal medicine physician and public health researcher with Memorial Sloan Kettering Cancer Center. Area of expertise includes working with primary care providers to address barriers for cancer screening and prevention among minority and immigrant populations. Specifically with this show, we're going to discuss the Latino population. Dr. Aragones, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thank you so much, Joan, for the invitation. I'm very much looking forward to this conversation. Let me just add that I have my area of work for the past 15 years has been on a cancer prevention and early detection, and in particular using vaccines like the HPV vaccine. We'll be discussing that to protect our populations against this very severe disease. So I'm very much looking forward to the next few minutes and discuss all these topics.
Tell us a little bit about yourself, though, sir. What made you go this way? Prevention is really very difficult because it's a lot of education, and you have to hit all the people that are in the play, in the show. So what made you do this? This is, I think, one of the more difficult areas in medicine to address as a full-time job.
Yeah. You hit the nail on the head. I was trained as a physician, or I did all the training that a physician goes through, but I knew that I wanted to do something that's called public health, population health. So caring for populations as a whole and trying to address health issues in the population rather than person to person. And in particular, the issue of cancer, the issue of early detection of cancer and prevention was always at the forefront of my interest. It's something that not a lot of people feel like can do. Not a lot of people feel like they have the power to actually prevent this severe disease, and one that many people see it as in a very fatalistic way. So I jumped into this issue since the beginning of my career. Started with looking at colorectal cancer and breast cancer prevention and early detection, etc. Ended up about 15 years or 16 years ago when there was a vaccine to prevent cancer approved. It's something that I really got very, very interested. And I'm sure we're going to discuss this, but I am a Latino. I actually did most of my medical training in my country of origin in Peru. And I feel very close to the Latino population, and I wanted to address some of these issues within the population that I felt comfortable, that I felt close to. Again, as we will discuss, HPV does affect very severely the Latino population. So this issue actually brought all my interests together, and I feel like in an area there was a significant need. That's how I ended up actually doing this work and here.
I think that's amazing. Not amazing at all. I think that's how most people in healthcare, they find their niche, and it's very hard to take them out of it. And especially when there's that personal connection and you're understanding the culture here. And that to me with HPV is one of the bigger factors that we need to be aware of. So now HPV, everybody gives everything an initial, and then we live with that, ABC, whatever, WHPC. But what does HPV stand for? And exactly what kind of a virus, if that's a good question, is HPV?
It's a great question. So HPV stands for human papillomavirus. HPV is actually a family of viruses. There are over 100 types of HPV, although only about 20 to 30 actually do affect significantly humans. And they're a type of DNA virus. It's the importance of that is not actually it's not too relevant, but what it's really important about this HPV or this type of virus is that it's extremely common. It is, and let me say it from the get-go, it is a sexually transmitted infection. but about 80% of adults, anywhere between 18 to 65 years of age, either have it or have had HPV at any point in their lives. So that's how common it is. Again, it's the most common sexually transmitted infection. And the bad part of this virus is that in some subset of populations, it does actually stay in our bodies. In the long run, it can cause several types of cancer.
Now, you mentioned in the older population. My first experience was actually talking about the vaccine with the early teens. But what gender? Is it gender? You said sexually transmitted. Is it one more than the other? Is it a specific sexuality that group that gets this? And the fact that it lasts so long, how are you going to identify it in people that don't get health care?
Yeah, this is fascinating too. So a couple of things. First of all, one of the reasons why HPV is so common is because the way that it transmits from person to person, as opposed to the more commonly known sexually transmitted infections like HIV, herpes, etc., is HPV only needs skin-to-skin contact. So it's enough to actually contact the genital area, the skin in the genital area, or even the mouth, to be able to pass it from one person to the other. Again, that's why it's so common. It happens actually, the infection usually happens early in life when you become sexually active. As I said, it's extremely common, and most people don't even know that they had it at during their lives. But there is actually a subset that do actually retain it for life. Now, to your question, do men or women get it more? This is actually a common myth, and one that actually when I went to medical school, it was actually taught that HPV was more common among women, and it's absolutely not the case. Men have as many infections of HPV as women, and men are affected by this virus, even to the point of getting cancer, as much as women. One of the issues with this infection is that when you get it, when you're infected, you don't know that you have it. There's no way for you to know. There are no symptoms. There's no real way for you to tell. And that's the bad part. The good part is that most of us, as I explained before, most of us actually our immune systems are strong enough. We're able to clear ourselves from the virus. The difficult is that, or the bad part of it is that about 10% of those of us that actually get infected do actually keep the virus for life. And sometimes 5 years later, sometimes 20 or 40 years later, in those cases, it actually develops or causes cancer, and cancer of 6 different places in the body. And again, that includes in cancer among men.
What areas of the body would have to be? I mean, I suppose it's like everything else. If you notice there's some change in your body, function or whatever, what body parts would we be thinking about? I mean, you mentioned the rectum. So would we be looking for change in bowel pattern or things like that? Or is it the same? I mean, I'm just trying to think now through all the systems, what I would be encouraging, family members or patients to look for.
First of all, HPV affects 6 different areas of the body. So we have the cervical area, or the cervix, in women, and that's the most commonly known. That's very well understood. Most women actually go through Pap Smears, so they understand that they're looking for changes caused by this virus. So that's one. The other one is anal, not rectal, but anal cancer. HPV causes anal cancer. HPV causes penile cancer, and as you can imagine, anal and penile cancer are among men as well. HPV causes vaginal and vulvar cancer, so the outside of the vagina, in women. And sadly, something that is getting more and more common, HPV causes cancer of the back of the throat, so the back of the tongue. And that is actually, again, among men and women. There are as many cases in men of all these types of cancer as there are in women. To your question about how do we know, well, the problem with this is that HPV infection does not give symptoms until it's too late, until it has actually caused cancer. And so, for example, in women, you might find that there's bleeding. In men, you might feel men and women, you might feel actually a lump in your neck that could be related to HPV associated cancer of the back of the throat. and they're very specific. So we don't necessarily talk about symptoms that this type of cancer can give, because one is very specific and two are very late. There are actually ways that we can find the potential cancer early. So, for example, through Pap Smears in women and to prevent cervical cancer or detect it early. But that only this happens only for cervical cancer. We don't have those tests for anal cancer, penile cancer, back of the throat cancer. So we don't have a good way right now to screen and detect early cancer of those sites, except for cervical cancer.
Wow. I never thought of that at all. I really didn't think of the differences in the genders and the way this is going to present. You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Joan Buckley from the nursing department here at Nassau Community College. And today you're learning about the HPV virus, its relationship to cancer, and the vaccine that's available to fight it. My guest today is Dr. Abraham Aragones. He is a medical physician and a public health researcher, and he works for Memorial Sloan Kettering Cancer Center. So now we've talked about the disease, and I know we could go on for a long time. You mentioned that we have screening for women and no screening for men, which brings us to this education piece. We understand there's a vaccine. How are you addressing this with the community? Because it is kind of a very private conversation that you have to have, and to address it on a large scale may be considered kind of awkward. And, and men and women perceive discussions differently too. So now you really want to address the males, and it may be difficult. So just how are you doing this to, just to educate them about this vaccine being available?
It's been very difficult. And first of all, not only in the Latino population, but in general, this continues to be a myth. There continues to be this myth that HPV affects only women, and that it doesn't cause any problems among men. So the conversation with men has been even more difficult. But education has actually worked, and bringing this information to the public, to a lay audience, has actually improved the acceptance of a vaccine that we haven't discussed much. But there is a vaccine actually to prevent all these types of cancer. Over 90% of the cases of HPV associated cancer in the United States can be prevented. So there is a vaccine. The earlier you get it, the better. But bringing this information and empowering the population has been very successful in my experience. But also talking directly to the population about their specific issues that the population might have. For example, we know, and this is actually within the larger society, that there is actually a distrust or growing distrust of vaccines. So we do talk about that. We do talk about how safe this vaccine is, how effective it is, how there are no long-term side effects. We try to actually have a very open discussion with the population, and we try to also educate healthcare providers to actually teach their patients about this vaccine and offer it strongly, not just to mention that there is this vaccine, but to say, look, there is a vaccine to prevent, thousands of cases of cancer in the United States every year. Your kid will benefit from this, so you should get it. So this education has been at the forefront of this. But also, and I think you touch on this, we have address or try to address the issue of access to the vaccine too. Sometimes, in most places, the vaccine in New York and the surrounding areas, the vaccine can be obtained for free, even though there is sometimes there's administrative fee charged to the either the children or the young adult getting this vaccine. But in general, you can get this vaccine for free in most places, and there should be no issue accessing it. So we try to address some of those issues as well too. And finally, the vaccine is actually not just one; it's a series. So if you're 15 years or younger, you should get 2 doses. So one today and the second one 6 to 12 months later to get full protection. Those are the current guidelines. And if you're 15 or older, all the way up to 45 now, that's the vaccine is approved all the way up to age 45, you should get 3 doses. So starting one today, the second one in 2 months, and the third one in 6 months. So it's important that you get actually all of them to get full protection. So we use reminders and several other tools to make sure that parents and young adults actually either bring their kids or themselves to get the full series of the vaccine, get fully protected.
Do you find it, preventative medicine is really, like I said before, is really tough. Did you find it more difficult with the parents of the younger generation, right, the younger kids, 15 and younger, getting them to understand that this could prevent cancer totally and, would be such a benefit? Did you have any trouble with them or did you not? It's been around a while. Mm-hmm. And I think the first time I was introduced to it was on this radio show, and it was a pediatrician trying to educate parents. And I had a young man with me who said his mother said, "Don't you dare go get it." And it was almost, she said, "You're not going to have sex, so you don't need it." And I think that it might be difficult or different when you're addressing different audiences. I think that's what I'm trying to say. Did you deal with the parents?
Absolutely. I think that's the beauty and the difficulty of this topic. So it is actually sexually transmitted infection. So we cannot hide from it. And that brings an enormous amount of issues when it comes to discussing this disease, this infection with parents. There are multiple ways to discuss it. And one of the things that we try to do is to make sure that we address the issue or we discuss it using population data. So for example, as I mentioned at the beginning of this conversation, 80% of adults will have or have had this infection. It's that common. Sometimes actually, and there is actually evidence for this, that even kissing can pass the disease from one person to the other. So you might think that your kid actually will never kiss, will never have sex, and will never have even, as I explained before, skin-to-skin contact, which is not penetration. It's not the other parts that most parents actually think of, but skin-to-skin contact. You might think that's the case, but their partner or their future partner might. So that person will actually potentially pass it to your kid once they're married or they're in their 30s, 40s, and it can actually affect their life and cause cancer. So one of the things that we try to do is to really focus on the fact that we have a vaccine that prevents cancer. If a parent tells me my kid is not going to be having sex, or I will not actually, I'm not thinking about cancer right now, they're young, I tell them, one of the first things that I tell them is that if I offer you a breast cancer vaccine or vaccine against breast cancer or colorectal cancer or lung cancer, you will probably say, yes, please, put it in my shoulder as soon as possible. And usually that actually brings them to, at least to the conversation. Once we actually pass that part, once we're open and discuss this, it's up to us, to providers, and I'm talking about all providers, physician assistants, nurses, physicians, etc., or pharmacists, to give a strong recommendation for this vaccine. We actually hesitate many times as healthcare providers, and we don't want to get into these conversations, or we think we don't want to get into this long conversations of sexual behavior and sexually transmitted infections, and potentially spend 5 or 10 or 20 minutes on a conversation like that. So we either offer the vaccine hesitantly, or we don't even offer it. And that is a problem, and we should actually address that. And part of our work is to make sure that the providers have the tools to say, here is a vaccine that can prevent cancer. It's part of these other vaccines that your kid will get at age 11, 12, 13, so get it. And that's it. We haven't discussed this, John, but there are actually an enormous other set of barriers to get this vaccine that are political in nature or anti-vaccine in movement. So we do have to address those issues too as well, to explain parents or young adults about why those are not based on science. They're not based on the safety or the effectiveness of the vaccine, but quite the opposite. They're just myths or misinformation that has been spreading in the population.
I don't think I could do your job. It's just too many angles. But you're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Joan Buckley from the nursing department here at Nassau Community College. And today you're learning about the HPV virus, its relationship to cancer, and the vaccine that's available to fight it and actually prevent it. So my guest today is Dr. Aragones. He is an internal medicine physician, but his biggest issue right now is for the public health, and population health is his priority, and he's working through Memorial Sloan Kettering Cancer Center. So where really now, you started talking on a very thing, and everybody's got to have it offered. You talked about the political piece. Can you just add a little bit, like how are you addressing the political piece? Like where? Do you do it in churches? Do you do it in clubs? I mean, if there's a community club or a club center or something like that, where are you reaching the people?
Mm-hmm. We do it everywhere, all the places that you actually just mentioned. And we don't shy away from having these discussions anywhere. And to be honest, I have found a very receptive population of parents, mostly in churches, in other religious centers, in schools. So we bring this information to everyone, and we have a direct conversation about it. We make sure that we touch in the different points that we think are important, and we make sure that we actually prime parents and prime young adults to actually go and get the vaccine, that feel empowered to get this vaccine and to feel empowered that they can protect themselves against these 6 different types of cancer. And John, we didn't mention this, but one of the things that I mention sometimes to parents, not sometimes, always, is that there are actually 45,000 new cases of HPV-caused cancer just in the United States every year. 45,000 people suffer from this, are newly diagnosed and suffer from this disease every year in the United States. And around 15 to 17 people die from these types of cancer every year in the United States. We have the potential to prevent that pain in almost 90 to 95% of cases with a vaccine. So why not giving that gift to your children? Why not giving that gift to yourself so you don't actually have to go through that, or your family member doesn't have to go through that? So usually these numbers actually open their eyes of parents, open the eyes of young adults. And again, once they get the first dose and they notice that there are barely any side effects, there's nothing like the feeling sick the next day or anything like that, it's just a little bit of pain in your shoulder, then they realize that, well, it was actually nothing, and they move on and they just go with their lives and get protected against this.
This radio discussion right now, I think, is so important, even for our community. And when we go to health fairs and things, and this will be a really quick story because I do talk about myself, but we bring the nursing students, and we were requested not to talk about birth control. It was right after the 10 o'clock mass, I think, and the audience was definitely Catholic. And don't talk about birth control, but please talk about sexually transmitted diseases. Mm-hmm. And the population then is family, which I thought was great. So when you talk to a patient, do you include the family?
Yes, absolutely. So we want to actually talk about this with the family members. So we want this to be not just the protection of the child, but also the protection of everyone that is within the age of that the vaccine is eligible for. So we talk about with parents. Most of the parents are the ones that make the decision about the vaccinated or not their kid at 11 or 12. 11 or 12 is usually the age that we recommend the most, and that's because it's before the kid becomes sexually active. It also, you only need 2 doses, so you get better protection with less vaccines. So we want to actually talk to parents and convince them to give them a good future, etc. But we also have this discussion with kids, and we didn't talk about this, John, but the HPV vaccine and HPV virus, actually, and some subtypes of the virus causes another disease that is benign, but it's extremely common and many young kids know, and that's actually genital warts. So warts of the genital areas, but also the mouth. And that happens in about 1% of young adults and even adolescents. So that's something that we use sometimes to approach this topic because it's a very well-known, very well-understood condition. And although it's benign and most of the time goes away and it's not associated with cancer because it's caused by what it's called low-risk HPV types, the vaccine has the additional benefit of protecting yourself against almost 100% of cases of genital warts. So that's another way that we approach this topic. And again, in this universe of different ways to discuss this and have a conversation about this disease and this vaccine.
What are the treatments like for genital warts, and what are the treatments like for HPV?
For genital warts, the majority actually go away. You will get 1-2 warts. Again, it's not just in the genital areas; it could be in the mouth as well too. As we discussed before, the virus does live in our mouth, and that's why it can cause back of the tongue or back of the throat cancer. But when you have genital warts, usually we wait. And if it becomes aesthetically a problem, we can remove them. There are different ways to remove them. Different doctors might have different preferences with cold, with a small surgery, etc. But again, most of the time it's just wait and see. They will go away. When it comes to HPV in other areas, as I said before, the only place that we really find it before it causes cancer is in the cervix. So women actually starting age 21 get Pap smears. Those Pap smears are to find, changes in the cervix. And if those changes are found, sometimes we actually test as well to see if there's HPV in that area. And we want to make sure that if there's, these high risk types of HPV, the ones that are associated with cancer, and if there's actually changes in the cervix that are significant, if they're moderate or mild, we can wait and see and have another Pap smear 3-6 months later. But if we do find significant changes, then there's actually multiple ways to treat that. And that's actually before it turns into cancer. So those are what most people call precancerous lesions. And there's a way to burn that area. There's something called colonization. So you remove part of the cervix where the HPV lives. And it's not a major surgery. Usually it has few consequences, although it could have some side effects. But it's very commonly done, and it happens over 1 million times in the United States every year. And that actually prevents those lesions from becoming cancer in the following years. So that's a good way to prevent cancer. But the vaccine prevents all this before even actually showing as a precancerous lesion. So our focus is always on the vaccine.
That's so fun. This is a lot of information for people, but I give you credit for doing this for a living. But what if someone wants to reach out and get some more information? We need a contact information line, a website or something like that.
So you can contact me, or you can actually find more information at msk.org. But one thing that I want everyone to get from this is that no one in this country needs to go through the terrible case of having HPV cancer, because there is a vaccine to prevent that.
Thank you for being here, Dr. Abraham Aragones. And we want to hope that everyone stays safe and continues to stay healthy, and you continue to do the great work that you're doing at Memorial Sloan Kettering Cancer Center. This is Joan Buckley from the nursing department here at Nassau Community College, and we want to thank all of you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.